In today's episode, we're exploring a new study recently published in JAMA Network Open. Survival benefit of immune checkpoint inhibitors by insurance status among patients with advanced cancer, led by Dr. David R. Baraghoshi and colleagues. This research examines whether all patients benefit equally from breakthrough cancer drugs known as immune checkpoint inhibitors, or if your chances of survival depend on something far more basic, health insurance coverage. We'll unpack the study design, review the survival differences across insurance types, and discuss what this means for patients, caregivers, and the future of equitable cancer care. This episode is brought to you by Humalite, a next-generation hydration solution designed to make chemotherapy more tolerable and recovery more manageable. Let's dive in.
Have you ever stopped to think if those, amazing medical breakthroughs we read about actually help everyone? Or do some people get left behind because of things like, insurance? That's really the big question we're digging into today. This deep dive looks at a really recent study just published in JAMA Network Open. It's all about these groundbreaking cancer drugs, immune checkpoint inhibitors, ICIs, and whether your insurance impacts your access. So our mission here is to kind of break down the key stuff from this new research for you, give you the shortcut, really. We'll look at what these drugs do, and then get into the surprising, maybe even concerning findings about who gets this life-saving care.
Yeah, it's a critical conversation because it really highlights that tension between scientific progress and, the practicalities of healthcare access.
Totally. So, okay, before we jump into the study's findings, can you give us a quick rundown? What exactly are these immune checkpoint inhibitors? They sound complex and definitely not like older chemo treatments, right?
Okay. That's right. They're quite different. ICIs are a type of advanced therapy, really a form of immunotherapy. Basically, they work by helping your own immune system recognize and fight cancer cells more effectively, sort of taking the brakes off the immune response. The first one got FDA approval back in 2011, I believe, for advanced melanoma. And we're talking about drugs, like tilimumab, nivolumab, pembrolizumab. They become really central to treating certain cancers.
Okay, so they leverage the body's own defenses.
Yeah.
Because they've changed the game. What does that mean in real terms for patients? How big is the impact?
Oh, it's significant. Really significant. These aren't just tiny improvements. Clinical trials showed major increases in what we call median overall survival for advanced cancers. We're talking months, sometimes more, compared to the older standard treatments. So for metastatic melanoma, ipilimumab pushed survival to about 10 months versus maybe 6.4 months previously. For non-small cell lung cancer, nivolumab got it up to 12.2 months from 9.4. And renal cell carcinoma, kidney cancer, saw a jump from 19.6 months to 25 months. Big increases.
Wow. Okay, so these are genuinely transformative, giving people really meaningful extra time. That's huge progress. But that progress leads right back to that tough question this study asked. Is everyone benefiting equally? Or does your insurance type determine if you get access to these breakthroughs? What was the core question they were trying to answer?
Exactly that. The study's main goal was to see if introducing these ICIs actually widened the survival gap based on insurance. Did disparities increase after these drugs became available? To figure this out, they used this massive database, the National Cancer Database, the NCDB. It covers something like 70% of new cancer diagnoses in the U.S., really comprehensive. They looked at over 183,000 adults aged 18 to 64, diagnosed with specific stage IV cancers, melanoma, non-small cell lung cancer, or renal cell carcinoma. And critically, they compared patients diagnosed before the ICIs were approved for their cancer type versus those diagnosed after, up to the end of 2019. The key thing they tracked was insurance at diagnosis, private, Medicaid, or uninsured. And the outcome was straightforward. Did the patient survive for at least 2 years? 2-year overall survival.
Okay, so a solid approach using a huge data set. What did they find? Did survival improve for everyone? And what happened to those disparities?
Well, here's the interesting part. First off, yes, 2-year survival did generally improve across all insurance groups for most of these cancers after ICIs came along. So that's good news overall.
Okay, good. So everyone saw some benefit.
Right. But, and this is the crucial, but the study found a statistically significant widening of the survival gap. Specifically, the difference in survival between people with private insurance and those who were uninsured grew larger for all 3 cancers studied.
Okay. So even though the tide lifted all boats, some boats rose much, much higher, leaving the uninsured further behind, relatively speaking. Can you give us some specifics? How much did that gap actually widen?
Sure. Let's take melanoma. For uninsured patients, 2-year survival went up from about 16% to 28%. That's a real improvement. But for privately insured patients, it jumped from roughly 29% to 46%. A much bigger leap. So when the researchers adjusted for other factors like age and stage details, the adjusted disparity, the gap itself, widened by 6.1 percentage points.
6.1 percentage points wider gap just for melanoma. Wow. What about the others?
For non-small cell lung cancer, the adjusted gap between uninsured and private widened by 1.3 percentage points. And for renal cell carcinoma, kidney cancer, they found that after accounting for a bit of a lag in adopting the new drugs, that gap widened by 6.2 percentage points.
Okay, so a consistent pattern for the uninsured falling further behind the privately insured. But here's where it gets really interesting, I thought. What about Medicaid? How did people on Medicaid fare compared to those with private insurance?
Right. This was maybe the most surprising finding. The study found that the survival differences between patients on Medicaid and those with private insurance did not change significantly after ICIs were introduced. The adjusted difference for melanoma was actually slightly smaller, technically negative 1.9 percentage points, but not statistically significant. For lung cancer, it was basically zero change, 0.4 percentage points. And for kidney cancer, it was negative 3.8 percentage points. Again, not a significant widening or narrowing. The gap stayed pretty much the same.
So let me get this straight. Survival improves overall. The gap widens significantly for the uninsured compared to the privately insured. But the gap between Medicaid and private insurance essentially stays stable.
Exactly. Which strongly suggests something about the role of insurance coverage itself.
Yeah, it points pretty directly towards the cost, doesn't it?
It really seems to. What's fascinating and maybe sobering is seeing how that financial piece seems to translate so directly into health outcomes with these expensive treatments. The study highlights that ICIs are just way more costly than older therapies. You know, the average Medicaid price per prescription was cited as $7,000 to $8,000, and a full course of treatment. The list price could hit up to $250,000.
$250,000. Okay.
Yeah. So if you connect that to the findings, it suggests that people without any insurance coverage just can't afford these drugs. The cost is prohibitive. It's not just the drug cost either, is it? It's having a doctor, getting diagnosed, navigating the system.
Absolutely. Insurance isn't just about paying the bill. It's often the key to accessing the whole system needed for these advanced treatments. For the uninsured, it can be a complete non-starter.
Precisely. And this reinforces just how critical insurance is for accessing cutting-edge, life-saving care.
So pulling this all together, the breakthroughs are real, but access isn't equal. What are the big takeaways here? What does this mean for policy?
Well, the study basically points towards needing policies that expand health insurance coverage, make it more accessible, and also finding ways to tackle the affordability of these new treatments. That finding about Medicaid is really powerful, isn't it? It implies that if those uninsured individuals had Medicaid coverage, their outcomes might look much more like those with private insurance.
Right. It's a strong argument for Medicaid expansion, especially considering many states still haven't expanded.
Exactly. And the study notes that as of recently, 10 states hadn't adopted expansion. And often these are states with lower average incomes and higher cancer death rates already, so the lack of expansion could be making disparities even worse there.
So expansion is one piece. Are there other solutions discussed? What about people with insurance who still struggle?
Yeah, good point. Insurance isn't always enough. The paper mentions things like better financial assistance programs, patient navigation services to help people through the complex process, but it also acknowledges challenges remain. Even with assistance, you can face delays, maybe your doctor isn't fully up to speed on the latest options, or the out-of-pocket costs are still just too high. It's not a silver bullet.
It really hammers home that it's not just about having the drug exist, it's about patients actually being able to get it.
That's the core issue.
Now, like all research, this study had limitations. We should touch on those for a balanced view. What did the authors point out?
Sure. They were clear about a few things. One is that insurance was only measured at the time of diagnosis. People's coverage can change, and they couldn't track that. Also, they looked at overall death rates, not specifically deaths from cancer, although they did some extra checks that showed similar results for cancer-specific mortality. And the study focused on just those 3 cancer types because of data availability for the newer drugs. ICIs are used in other cancers too. And importantly, it's a population-level study. It shows associations like insurance status is associated with survival differences, but it can't definitively prove cause and effect based on who specifically got the ICI treatment. It's showing trends across groups.
Got it. Important context. So let's wrap up this deep dive. The headline seems to be, these amazing breakthrough cancer drugs, ICIs, are definitely working, improving survival overall. But crucially, this research shows a significant widening gap in who benefits most, with uninsured individuals falling further behind the privately insured. Yet the fact that Medicaid patients saw similar gains to the privately insured really underscores the power of comprehensive coverage.
That's a great summary. And it leaves us with a really profound question, doesn't it? As science keeps giving us these incredible tools, how do we make sure they reach everyone who needs them? Not just those fortunate enough to have the best insurance or live in the right state. How do we balance that amazing innovation with, basic fairness and equitable access to health? Something for all of us and for policymakers to really think about.
Thank you for joining us on Cancer Studies Explained, making oncology research understandable. This episode was sponsored by Humolite, the science-backed hydration solution designed to make chemotherapy more tolerable. To learn more about how Humolite supports patients undergoing treatment, please visit humolite.com.